Hi, Victoria with Santa Barbara Business College. I'm a nursing student and I'm going to demonstrate a nasogastric tubing placement. And so I will start with checking the medical records for an order. We do have to have a physician's order in order to place this type of tubing. So I'll check that first, and then I will identify the patient and introduce myself. And we can check the patient's risk for identification or ask the patient their name. And so I'm going to go ahead and gather my equipment, wash my hands, and put on gloves. Okay, I've got my equipment and I'm going to put on some gloves. The position of the patient is high Fowler's, which is a 90-degree angle. You want a pillow behind the patient's head and neck for comfort. And you want to make sure that the patient is not having any pain. You also want to make sure and inspect the narrows to see if there's any blockage. Ask the patient if they've had any recent surgery or trauma to the nose or mouth. And so the patient is pretty much in high Fowler's. I'm going to drape the patient because there could be vomiting or spillage, and we don't want that. The next thing I'll do is check the tube and measure. So we're going to measure from the tip of the nose to the earlobe, and then from the earlobe to the xiphoid process. We're going to make a mark there because that's the length of the tube that we need. So I'm going to mark it with tape. I'm going to go ahead and coil the tubing to make sure that it's flexible, and then I will lubricate it. So I'm going to ask the patient to lift his head back so I can insert the tube. You're going to insert into the nose to the back of the throat. Once it's there, you ask the patient to put their head forward with their chin to their chest and ask them to swallow. Swallow, swallow, swallow until I get to the area that's marked. Once I get to the area that's marked, I'm going to listen for positioning. There's two ways to do that. I can insert air into the tube and listen to the bowel to make sure the air does insert into the abdomen. Okay, sounds good. The other way to check for placement is to take an x-ray of the patient's abdomen. So I'm going to go ahead and connect the tubing to suction and secure the tube to the patient's nose. And then I'll turn on the suction and make sure the patient can speak and that there's no obstruction or anything bothering the patient. I will go ahead and make sure the patient's side rails are up, the collites in place, put the patient back into a 30-degree angle, and take off my gloves, document, wash my hands, and document the procedure. The next step I'm going to do is remove the gastric nasal tube from the patient's nose and stomach. And so I will wash my hands, offer privacy, and let the patient know that this part of the procedure isn't as tedious, it's not painful. So I'm going to position the patient again after I get my gloves on. Again, I have the patient draped and ready to go. So what I'm going to do is ask the patient to, I'll pinch the tubing, disconnect, or actually turn off the suction, disconnect the tubing, pinch the end of the I'm going to listen to vowel sounds first and make sure there's active vowel sounds. Before we remove the tube, that's pretty important. Everything sounds good. Okay, so now I can remove the tube. I'll pinch the end of the tube, ask the patient to take a deep breath and remove the tubing. And And I will discard the tubing and the suction container completely. And make sure the patient's comfortable, offer a towel so they can wipe their nose. Sometimes there's something coming out of their nose, so you can go ahead and offer them or go ahead and wipe the nose. And so I will make sure the patient's comfortable, put up the side rails, offer the call lights, and make sure they're in a 30-degree position, which is semi-Fowler. Wash my hands and document. Thank you very much.